Hi guys, this is Karthik from Caapid Simplified, and of course Dr. Nourah.
Hi.
We have with us a very special guest, Dr. Viral Dev. He's been a constant champion advocate of whatever we've been doing so far, and we're very excited to co-host this recorded webinar with him, covering ethical scenario questions, a topic that most of you seem to have a problem with and have pinged us in recent past on WhatsApp about how to answer them. If, however, you still have questions after watching this video, feel free to go to the description and ping us. We would reply back as soon as possible. Now to a small introduction from our guest, Dr. Viral. Can you speak a few words about yourself?
Yeah, sure. I am Dr. Viral Dave. I finished my Bachelor of Dental Surgery just a couple of years back from Mangalore, India. And I come basically from the western part of India, that is Mumbai. And I'm also in the process of applying to dental schools to get the international student program at DDS degree. And it's a great initiative by both Karthik and Dr. Nourah, this Caapid Simplified, and I'm very happy to be a part of this program.
Thank you, Dr. Viral. So the format of this interview is going to be where Dr. Nourah will ask you a couple of ethical scenario questions. We hope you can answer them live, like it would be like a mock interview. Towards the end of this, we'll take a small break, refresh, come back, and give you suggestions as to how you can improve your answers.
Sure.
The fact that you have volunteered to do this so that everybody else can watch it is very generous of you, and we appreciate that. So on that note, are we good to begin?
Yeah.
Thank you. Go ahead.
Okay, Viral. Are you ready?
Yeah.
All right. So we'll be covering ethical scenarios in clinics, in schools, and also in terms of your own personal, thoughts. So let's start with the first question, which will be probably like a clinical scenario. Okay. So let's say a 15-year-old boy walks into your office with his mother, and he has several decayed teeth. But what you're most concerned about is tooth number 19, which has a gross decay on it, and it has and you do your clinical and radiographic examinations, and you find out that the tooth has a chronic apical periodontitis and the pulp is already necrosed. This child also has a class 1 occlusion, only the molars. Apart from that, he has like badly aligned teeth, so he'll definitely need an ortho treatment. So you advise to the mother, after looking at all the reports, that this child is eligible to go through an endodontic therapy and that you can save that tooth. But then the child and the mother, they look at each other, and the mother is telling you that she's heard about bad experiences with the endodontic therapy in the past, and she's also concerned about the cost of the treatment. Endodontic therapy versus extraction, endodontic therapy is more expensive. So she looks at a child and she confirms, and then she tells you, let's just pull the tooth out. So this is what is placed in front of you. How will you handle this kind of a situation?
Can you just repeat the age of the child?
He's 15 years old.
All right. So I think the first thing I would like to comment on this is it is the well-being of the child, and also when you have to consider the cost of the treatment. These are the two main things I would first like to address. I would first try to have a discussion with the child and a parent together, and would like to tell both of them the pros and cons of both the ways of treatment that we plan to do so. I would first try to tell the parent that because your child is just 15 years old, and if we try to pull out the tooth at this point of time, there are severe other consequences that he has to face, like say migration of other teeth in that place, or supra eruption of the opposing tooth. And I would like to explain them all the conditions that a child might face, and how it might impair his further other teeth which are in relation to that tooth. So this is something clinically I would like to explain the child. Secondly, you know, I would also like to tell them that how uh, the investment in the beginning, I mean, when you invest something in dental procedures at the initial stages, how it is beneficial to you at the longer stages if you maintain it well. So I would like to advocate a conservative treatment and in the beginning. Uh, but at the same time, I would give them an option of extraction, because it's like the right of patient to decide ultimately what they want. And I would like to tell them what are the things that are needed after extraction in order to preserve the other teeth around it, so like a prosthesis or something. So, and I would also try to explain them that, you know, how natural teeth is better than an artificial tooth at the later date when you try to replace it. Basically, I would like to explain all the pros and cons, and then uh, leave the decision up to them as to how they want to proceed. And would like to, you know, take everything in writing, whatever I have discussed, and I will explain them, and ultimately take their consent to do whatever procedure they want to go ahead with it. And yeah, that's how I go about.
Perfect. Okay. So we'll do the discussion in the end, right?
Mhm.
Okay. Thank you, Viral, for
Unless you
your
want to swap
perspective.
things out.
No, I think we can do it in the end. Yeah. Okay. So the second question will be, you have a patient named Mary. So she's been coming to you since childhood. She's a teenager, and what happens is she comes to your office one day and she's waiting for her regular dental care. You know, prescribe a radiograph for her, so she's waiting outside your radiology office, and then she sees a sign that says that pregnant women should tell the doctor they're pregnant because they're not supposed to undergo radiation. So she looks at it, she gets really scared, and then she calls you separately, and then she says that she's pregnant, but then she's not told her parents yet. You and her parents are family friends, and she's, you know, you've known her since childhood. So now you have to make a decision, and she also has some tooth that needs to be taken care of. So in this situation, how would you handle it?
Yeah, so it's a good question. I would like to first have a, you know, a, a private conversation with the patient and try to explain her, you know, that how firstly, because she has come for a dental visit, we'll try to counsel her on the aspects that pregnancy could affect the dental related procedures, and how, what all things we can do when she is pregnant and what all things we should avoid. Uh, but you know, when she asked me that, okay, she has not told her parents about this, so I would, uh, you know, try to uh, just casually go and ask her, like, you know, what is the reason behind that, if you don't mind to, you know, tell me or something, if I could be of some help or something. And then I would like to tell her, like, if she says, if she discloses, what are the things that would happen in the family, and if she does not disclose, what are the things that would happen, and who are the people who are associated with her, when what are the consequences they would face when they come to know, when they hear this at the first time. And I think it is, I, after having this a good discussion, if she does not, if she's not willing to, you know, disclose it to her parents and all, I would respect that, because it's her right. And to, you know, it's a professional relationship, so it's her right, whatever she wants to uh, disclose or whatever she does not want to disclose. And if she is convinced by my explanation, or if she, you know, somehow tries wants to disclose it, I would support her, and I would friendly try to, you know, be supportive to her in front of her family as well. And I would like to tell that, okay, there are times when the person has to take some, maybe some hard decisions or hard choices sometimes, and she has done it. But at this, I think ultimately I would respect her right and her opinion. And I would still try to counsel her in all the ways that I can.
Okay. So in terms of the clinical treatment itself, how would you handle that? Because she has a dental need that needs to be taken care of. You know that she's pregnant, so she cannot go through that, that radiographic examination. So what kind of explanation will you give to the parent if the child is not willing to disclose it? And how will you treat her?
First thing is, I would like to ask her in which trimester she is in, because I think we can try to do some procedures in the second trimester of the pregnancy, but first and third trimester, they say that it's totally should be unavoidable. But I think I would try to engage. I have a group discussion at this stage. I mean, with parents and her together. If she wants to proceed with the treatment, and if she tells me
no, right?
No, so if she tells me that if you want to, she wants to get the treatment done, and if that is the case, then and ultimately, if I think, I don't know, if it's like a minor treatment or something, if it's like a filling or something, then there is no harm in, even if there is a pregnancy situation. So I don't mind doing such a treatment. But if there is something which would affect due to pregnancy situation, then, and if it is going to become a social issue or something, and if I think that okay, in future I'll be penalized for it when it comes to a legal scenario, then I would definitely not take that step, and I would ask her to speak with family as well.
Okay, good. Let's move to the next question. No, sorry if you see me looking down. I'm just writing notes based on what you're telling me. Okay, so the next question is, so in your clinical practice, let's say a new patient comes to you, and you start examining the patient, and you see that most of the restorations or the treatments that the patient has undergone in the past has not been good. They're all failing, or they have like overhanging restorations or open margins, something like that. So the patient's like, she's very unhappy with the previous dentist, so she's constantly complaining about that dentist, and she's like, I'm constantly in pain. Is something wrong with what they've done? What should I do? So what will you do, and how will you handle this?
Okay, so I would first examine the patient clinically and evaluate what are the things that are not done properly in her mouth, and I would advise her my opinion as to what things need to be rectified, or what need to be, what procedure she has to undergo. But I would not, comment on anybody else's work or anybody else's treatment that she has undergone, because it is unethical for me to comment on somebody else's work, and I would refrain from doing that. But I would advise her what all things need to be done, and I would like to uh, leave it on the patient if she wants to get it done or not. And if she says yes, then I would definitely go ahead with it.
Okay, nice. Short, crisp answer. I like that. Okay, so let's go to another different scenario. A 48-year-old patient, he walks into your office, and he's been coming to your office for quite a while, and he's known in your office for his obnoxious attitude. He's very rude to anyone who takes care of him. He thinks that you're just a service provider. So he has extremely poor oral hygiene, and he also sometimes misses his appointments. So right now he's in your office because he has all these missing teeth and gaps in his teeth that he wants to fill it with fixed partial dentures. He only wants fixed treatment. But then you evaluate his oral cavity, and you see that he has a lot of periodontal health that needs to be taken care of. So you tell him that he has to go to the hygienist for about 3 or 4 appointments where his periodontal health needs to be stabilized. Only then we can move into the fixed partial denture treatment. So he agrees to that treatment, and then he starts coming for the appointments. In the second appointment, like how in every appointment the hygienist will tell you that you need to brush, you need to floss, you need to do this. So in the second appointment he loses it. He starts screaming at the hygienist saying that, don't tell me to brush and floss and, you know, all of these things. It's your job to, you know, clean my teeth. It's my job to pay you. This is what he says. So now there's a situation with the dentist. There's also a situation with your team member who's the hygienist. So how would you handle this?
I would first try to, counsel the patient in this case, because see, when we plan the treatment at that time, I would like to tell him the pros and cons and what are the duties that he needs to perform when we first plan the treatment itself. And I would, I know that, okay, because he's coming in my office since such a long time, and I know how his attitude is with my staff. So I know that, okay, he may not be able to, handle his oral hygiene well. So I would first try to tell him on clearly that, okay, if this is a way we are planning the treatment, that first we do the periodontal procedures and then the fixed partial dentures. He has to maintain his oral hygiene well. If he fails to do it, and if we are giving him the fixed partial dentures, which because once he signs up for it, we would move ahead in that direction. But then we would not be responsible if he doesn't maintain the oral hygiene well, even after we give him the fixed partial dentures. So I would make this clear right in the first appointment and tell him that he has to be careful. Otherwise, there is no point in we moving towards this kind of treatment.
Okay, so you would explain to him that if we go ahead with the fixed partial denture without him following all these instructions that you're giving him, then it will not lead to a better outcome.
Better outcome.
Right. Perfect. Do you want to take a sip of water, or are you okay?
No, I'm fine.
Okay. Let's see. Okay. For the next scenario, I'll give you a specialization where you become a periodontist and you're working and you have a lot of referrals from other offices. And on that particular day, you have a patient referred from a long-owned private practice in your own area. You know that he's known for his treatments. He might not be very good at his treatments, but he's very good with his patients. So his patients trust him a lot. So this patient has been seeing the previous dentist for about 10 years. And he was referred to you because this patient has been having halitosis and mild bleeding in the mandibular molar area. So when you start examining the patient, you find some over-contoured crowns with loose interproximal contacts. They're only loose, they're not open contacts, and the margins are, the crown is obviously over-contoured. So this is causing food lodging and chronic inflammation. And that's the reason for this halitosis and mild bleeding. So the patient's asking you, are the crowns causing me problems? I don't want to lose my teeth. What would you do as the dentist who's, getting a referral patient?
This is a tricky question. I would see first as a periodontist when they have referred me to. Can I just interrupt and ask me for what they have referred me for?
So the patient has been referred to you because they have, the other dentist has checked if there are problems with the crown or problem with something else, and they haven't been able to find out any other problem. There's no caries, there's nothing. There's only like mild bleeding and there's halitosis. So they recognize that there's a problem with the periodontal health. So in the US, it's a thing that if it's a periodontal health issue, then it will be referred to a periodontist unless they think that they have the competency to take care of it. That's why.
So I think as a periodontist, I would try to evaluate the gum condition and the periodontal health of the location where it is bleeding and the surrounding areas. How is the condition of the oral tissues? And then see if I find that, okay, if there are the reason is because of the crowns, usually maybe because it's over contoured crown, so the food lodgement is happening because of that. If that is the case, I think I would try to I would it's not ethical for me to comment about somebody else's work in this case, but I think I would try to explain the patient that the cause is a food lodgement and he should maintain his oral hygiene well. But at the same time, I would like to have a word with his general dentist who did the crown, and maybe I would ask him to have a further look at the crowns that are made, and probably try to, if there is no finding in perio related anything perio related issues, then I would just in my referral this thing I would write that perio health is fine, and I would just comment on the perio aspect, and I would not try to tell anything about the crowns, but I would try to have a discussion with the general dentist who referred me, and I would maybe try to ask him or point out that having the over contoured crowns could be one of the reasons. But in front of the patient, I would not say anything, and I would just try to say that whatever you are referred to me for, and that thing is fine. Like the perio aspects are all fine.
Okay, great. So to summarize for that answer, you said that you will only address the periodontal health of the patient, and you'll only talk about the periodontal aspects of what's going on with that patient. And then you would have a discussion with the general dentist about the possibility of the crowns being a problem, right?
Yeah.
Okay, perfect. All right. Now we'll take you back to school. So in the school, you know that you'll get to work with different kinds of instructors at different times. But of course, you'll be allotted one specific instructor at different stages of your treatment. So let's say you were allotted a patient, and then you have one instructor who's working with you. You come up with a treatment sequence for that patient, and then you ask the patient to come back 2 days later to start with the treatment. So the patient's here, you're ready to get started, but the instructor is absent. He's not there. So now you have to get started with a different instructor. Now the other instructor comes, looks at your treatment sequence and says, this is not the way to go. And he gives you like a different kind of treatment plan to proceed with the patient, for which you'll have to explain that scenario to the patient, and you'll also have to make a decision about what you need to do. So how will you handle this?
So in such a scenario, I would first have a word with the second instructor who is telling me to change my treatment plan, and I would just try to discuss with him whatever we had planned for the patient 2 days ago with another instructor, and I would try to explain him the factors which led us to plan that treatment at that point of time. But if he still disagrees, and if he says that no, this is the way you should go about, and this is the treatment plan that you should follow, then as we have already explained it to the patient before, and it would not be ethical for, I mean, not ethical, but I would first try to you know com- convince myself also with the treatment plan, because I was also not sure of the second treatment plan. So I would try to discuss it out. I mean, I would try to go and talk to the main director who is there in the department, or in the whoever is the in charge person, and I would try to tell him what are the conditions that we are facing because of what second instructor suggested us to do, and then I would try to uh, go with the I think it's better that if Professor A is not on leave, but if there is any way to approach him, if there is any way to call him or something, and if we can discuss it out together, Professor A, Professor B, and say the director, that would be the best. I would try to create a sort of hurdle and try to get everyone's opinion and finally come down to a conclusion. And that's how I would try to explain the patient. If there is any change in treatment plan after the discussion, then I would try to inform the patient. Otherwise, we would go with the same treatment plan that.
Okay. Awesome. Let's move on to the second one. Okay. So same school scenario, you're working on a patient with an instructor, and you know what the diagnosis is, and then you go to the instructor. So the instructor gives you a sequence of treatment which you don't agree with. You think it's logically wrong based on whatever you've learned. You just think that this is not the right way to go. So what will you do in such a situation?
Yeah, I think I would discuss how to.
Sorry to interrupt. Let's say, for example, that he wants you to do like a direct pulp capping in a pediatric patient in a deciduous tooth. What would you do?
Yeah, so I would try to present in the facts that I have learned so far in my dental career and all the cases which I have seen. What are the things that I have learned? And I would, try to learn more about his way of treatment planning and what makes him think that way. I would try to have an open discussion with him, and ultimately, I think I would come down to a conclusion in which he suggests me to do, because I am working in under his license in a clinical setup. So ultimately, I would not question his decision, but I would like to have an open discussion before we come down to a conclusion.
Okay. Great. All right. Ready to move on to the next scenario? Okay. So now again, we're back into private practice. And then there's this, so you have this patient who's been coming to you for 10 years. She's a very good patient. She trusts you a lot. Recently, although she's been having, some sort of unexplained pain in the upper right quadrant. So you start to do some equilibration, you're changing crowns, you're changing restorations, you're trying all sorts of treatments on her, but it's not been working. She's constantly having pain. She's constantly coming back to your office. So what happened was one weekend you were away somewhere and she wasn't able to reach you on your emergency number. So she had very, severe pain. So she went to a different dentist just to get some sort of a medication. And the other dentist looks at the teeth, examines it, and she diagnoses it as a fractured tooth. She says that you have a root fracture, which is why you have this pain. You have to get that tooth extracted. But, the patient gets really scared. So she just says, just give me some medications. I'll take care of this with my dentist. And she just leaves. So she comes back to your office and she's very anxious. She tells you that this is what the previous dentist says. Is this the reason for the pain? Please do something. And even if it needs extraction, I want you to do it. So how will you handle the situation?
Yeah, I think it's a very interesting question. I think in this case, I'm not very sure as to what from my last visit and my current visit, what are the things that she might would have there are cases that the tooth would have fractured in between the two appointments. She would have had some hard food or anything, which I am not aware of that. So I would first try to ask her the case history and the because since my last appointment, I never had that finding in my records that it was a fractured tooth, because I presume that last appointment I did the evaluation thoroughly along with the x-rays and everything. So that is something which I would like to first explore upon, whether it was what what was the missing information that is there in this case. And then if I find that okay, if the tooth is fractured, then I would uh, basically try to advise her on what sort of treatment that we are planning to plan about. Like if it's a fractured tooth, then we might go for extraction if she wishes to, and then maybe replace it with a prosthesis or something. But whatever I would try to explain her all the sorts of other treatment options also available, like say go for implants or something like that after extraction. So I think this is how I would try to approach the situation. I would try to, if there's a vertical fracture, then I would try to explain the cause. But if there is no, like suppose if I find that okay, it was misdiagnosed, then I would try to tell her that according to my evaluation, it is not the case, and we are doing our best to give you the best treatment possible. And if suppose I'm doing all my case and if it is still if the cause is not found out, then I would try to refer it to somebody, refer it to some orofacial pain specialist or somebody who can be of further help to us in diagnosing the condition if there is nothing dental origin related.
Perfect. All right. I have 2 more scenarios for you. Okay. So you have this patient, she's a new patient, and her concern right now is sensitivity to cold when she brushes her teeth in the upper right canine area. So she has a cervical abrasion into dentin on the facial surface of tooth number 6. She has a clinically sound distolingual amalgam on the same tooth that was placed probably several years ago. The treatment plan that you've decided is a class 5 resin restoration. So she's pleased with the appearance of the restoration and she says it's all good and she leaves. But the same evening, she's calling you and she's in acute pain. She calls your emergency number and then she comes in for an emergency appointment. She has throbbing pain for the past 2 hours. She's very angry and disappointed. And you tell her that probably a pulpitis might have developed. So she gets extremely angry and she's like, why didn't you tell me this could happen? Let's just say you didn't discuss it with her initially. So you prescribe analgesics and then you see her the next day. That's when you determine that the patient does have irreversible pulpitis. So that will require root canal therapy. You try to explain to her that this dramatic response can happen due to placement of small resin restorations in some patients due to various situations, maybe because of the previous restoration that she had. It could have been a deep restoration that you did. But she's very upset because she's heard bad stories about root canals in the past. And also there's this error that we didn't explain to her initially about it. So she gets very angry about the expense that she has to pay because of this. So what will you do in this situation?
Yes, I think first thing is I would I would apologize as we did not explain her this uh, this alternative that could go wrong. Uh, I would try to tell her what are the at the present moment what are the things that we should take care of, and so that it should not worsen it further. I would first try to calm her down and try to explain her in a very polite way that because because of the class 5 caries, there are cases that we face in which it turns into irreversible pulpitis, and also tell her that the restoration that was done previously, also there were chances that it is in close proximity to the pulp or something like that, and which could precipitate further to lead to such condition. So I would try to explain her all the aspects that first led to this condition and try to calm her down in that sense. Then I would try to explain her at the current moment what are the things that we can do for her and why we are advocating root canal treatment. I would try to explain her the importance of that as we are trying to be conservative and save the tooth. And also it helps the other teeth around it to have a good life after that. But as it comes to the expense part, I would you know I would leave it to her because I would try to explain her that whatever the insurance would include, if that much we can do it, it's fine, but otherwise she might have to pay from her pocket if we go for the root canal treatment if she's willing to. Otherwise extraction is always a possibility where we can pull the teeth off and give him something, uh, some processes at a cheaper cost that is available. So that way I think we can go about. But if she says that okay, I agree that okay, it was my mistake that I did not inform her, but I am not sure on this case whether I would try to offer her completely free treatment or not. I would consider that okay, I did not inform her one of the possibilities that could go wrong, and maybe probably try to give her some discount if she wants to go for a root canal treatment, because it was partly my mistake also. But if not, if she's willing to go for an extraction, I would leave it up to her to decide.
Okay. So we are to the last scenario now, which is actually kind of a common scenario that all of us face. So this patient comes into your office. He's a 60-year-old male, and he wants to improve his appearance with a new set of complete dentures. There's nothing wrong with his previous dentures. He's just not happy with the shade of the teeth. So it's quite an easy case, right? When you have such kind of a denture. So you completed everything, and he says that I want to look young, probably because he has a new girlfriend or something. I don't know. As you begin tooth and shade selection, so Mr. David says that just give me the whitest shade that you have. So you tell him, or you try to explain to him that it's not going to look good. It's going to look artificial. Why don't you try this kind of a shade? But he just, he dismisses you, and he says that I just want the whitest teeth.
Right.
So how will you handle this?
Yeah, I think this is a very common scenario we all face. I would try to first demonstrate the shade with the help of a shade guide. I would try to demonstrate the shade of the tooth with his skin color and with his complexion of his skin. I would also tell him that okay, this is a very commonly faced scenario that all of us as a dentist face, and we tend to advise patients to go for a shade that actually matches with the uh, with the complexion of the skin. And in your case, it is not the whitest teeth that would matter when you smile, but it is mainly with the the exact shade that matches with your the facial complexion. And I could probably show him a few of my cases which I've previously done, which I already have say informed consent from the patient to show. And I would try to show some of the complete denture cases and tell them that okay, see, a person like you who also wanted to have a very white teeth, but when we suggested him to go for something more on a darker side, it is actually looking more natural and not very artificial. And this way it would help you also if you go for this more darker shade. So I would again, like every time, I would explain her the pros and cons, but ultimately I would leave it to him. But I would tell him that okay, later if you find any changes, if you wish to do any changes or something, then as a dentist I am not responsible, because I have already explained you before. And if you wish to change the set of the teeth, then you may have to go for a completely new denture. So I think I would like to explain him in this.
Okay. Perfect. Great. First, I want to tell you that you did a really great job. I think you kind of approached all of the scenarios in different dimensions. You didn't just stick to one dimension. That was nice. Great answers. But I guess I could just touch upon how we can improve the answers and what kind of aspects you can bring in.
Sure.
There are 3 ways in which you want to improve your answers. One is try to be succinct. 2 is if you're thinking about it in one dimension, then I like how you were thinking out loud. That's how I want. That's how you have to answer ethical scenario questions. And third is how we can bring in the ethical principles in different ways into the answer, which you did in some situations, but I want to point that out so who's watching this can also understand how it's done.
Okay. Sure.
So let's take a small break where we can drink water, just walk around, stretch, and then we'll come back to this. Okay?
All right. Thank you.
Thank you. Right, Peter, are you ready?
Yeah.
Okay. So let's come from the first scenario. Okay. So initially, first I'll just tell basic things about answering ethical scenario questions. One is to first try to clearly understand the question that the person is asking. Sometimes ethical scenarios can be long, sometimes it's really short that they're telling. It's always important to take a moment, think about it, and then answer. Some of the questions that the interviewers ask you might be something that you've already come across during your preparations. So you don't want to show the interviewer that you've prepared. Any ethical scenario will require a little bit of thinking. So when an interviewer asks you a question, just take a moment, like think about it, just think how you want to frame that answer, and then start thinking out loud. Like this is how I'm going to handle it. Like, you don't want to tell them, I might do this as well, or I might do this. It's okay to tell that I think this is how I would handle this, but there are also other ways in which you can handle it if you want to address the other situations. Because what I wasn't able to take away, even though you were giving great answers, is what you are going to do. Because there were multiple, scenarios that you were giving me, which were all great, but I wanted to know what exactly you would do. What is your philosophy of treatment, right? So that's what. So that's the segue to bring me to what actually ethical scenario answers are. There's no right or wrong answer, right? You have like so many ways in which you can answer that answer, because it's like I have something that's morally right for me, you have something that's morally right for you. So how do we come to a right answer? That's when we try to bring in the 5 ethical principles, right? Which is like autonomy, beneficence, non-maleficence, justice, and veracity, which you brought in a lot of the answers. So it's important to talk about it in those perspectives, which I really, I saw you bringing it in a lot of answers, which is great. In the first question where I asked you about, so the 15-year-old boy who had number 19 chronic apical periodontitis and he needs to get it extracted. So first let's discuss about how can you handle the situation. One could be following what they're saying, following the patient autonomy and extracting the tooth, right? Another would be, extracting the tooth after having the mother sign an informed consent saying that this so-and-so will happen if I extract this tooth, but still you are giving me consent to extract this tooth. That would be one scenario. So the scenario you gave were giving the option of extraction, but also explaining to them what would happen, right? The consequences. So your answer kind of falls into that category, right? So the one thing that you kind of missed out over there was documentation. Like you need to document what has happened, because otherwise the patient might come back to you in like 2 days or probably like 2 years when the patient's occlusion is not right and tell that it's your mistake, right? Medical legal cases are extremely common, and you want to try to avoid that with documentation.
I think I mentioned the informed consent part, right?
You did? Okay.
Yeah, at the last time I mentioned.
Okay, so that's what is happening. Okay, so I'll just tell how I would handle this situation. So in this situation, I think personally that for a child who has stable class 1 occlusion in the molars, orthodontists would really think that it's very valuable. So I would not want to extract the tooth. It's not morally right or legally right in my situation. So what I would do is I would explain all of this to the patient, and if the patient still disagrees, I would refer the patient to my orthodontist. and try to have the orthodontist explain to them the situation and how in the future what the patient has to undergo and how this endodontic therapy would be helpful for that. And in spite of that, if the patient says no, then I would have the orthodontist carry that on or refer the patient to another dentist, but I would not take care of that situation. I would just make sure that the child is taken care of. But it's not morally right for me, right? So that's my philosophy. But your philosophy is also right. All I ask of you is to just speak about that situation, like how you would handle that situation. That was a good answer. The next question is about the pregnancy, right? So the pregnancy question, I know it's very difficult.
I messed up a little bit, I guess.
Yeah, no, there's nothing wrong. I mean, you didn't mess it up. It's just that it's very difficult to answer that question because you want to comply. The one thing that you didn't mention there was HIPAA. So just, I know that that's where you were getting at, but just telling that also helps. And you spoke about how it's important to respect confidentiality, which is HIPAA, which is all of those things. So it's great that you said that. And you said about, you explained to the child about why it's, what are the things that you can't undergo, what you can undergo, all of those things. When it comes to the treatment itself, which I was trying kind of pushing you to answer, was so there are multiple, ways in which you can handle that. One is, so you can't tell the parent without the child's consent because, under HIPAA, whatever the patient tells you is only for you. You cannot tell it to anybody else, right? So one is good, what you said, like trying to convince the child to tell the parent, right? And you being supportive of it. Yeah, so I just felt that in the discussion part, you went a little too far, where you were, I just felt that the answer was too long when it could have been kept a little short. So how I would handle this is very similar to your philosophy. I would try to explain to the child the importance of explaining it to the parent and, what could go wrong, what could go right. There's always like a very thin line between, trying to be friendly with the patient, trying to gain their trust, and also like crossing the line. So you need to make that
balance between the
keep that balance. There's professionalism and there's also the other thing, right? So although that they are family friends for you, there's this professionalism that you have to maintain in the dental office. So your responsibility is in taking care of the patient's dental needs and taking care of the the confidentiality part. So explaining to the child the importance of that is one thing, and also explaining to them what would happen if you defer the dental treatment. So what can happen, and your options over here for dental treatment would be like, if she disagrees to tell her parents, so she's a teenager, so she cannot consent for her treatment, right? So only option that you have is to defer the treatment until she gets the courage to tell her parent. Yeah, so eventually she has to, because she's pregnant. So you have to defer the treatment, or as you said, you can do certain treatments that are not harmful for a pregnant patient, which does not involve radiographic examination or things like that. But yours was a good answer. I just wanted to address the treatment part of it. Some people also address this by telling that I would talk about it to the mother. That's not a wrong answer either, because you start to weigh, right? With ethical principles, you always weigh. There's always a trade-off. You see which is better over the other, right? So if you're telling the parent does more good than bad, then some people would prefer to tell the parent. So that's not a wrong answer either. Okay. So the third question about a patient comes into your office and you find badly done restorations, how will you handle this case? So in this, one thing that I wrote for you was take a breath, because that's when I thought that you were immediately telling the answer. So you will tell your opinion and you'll talk about the procedures to be done, but you will not comment on any other work, which is unethical. That's good. That's how I would handle it as well. I will only talk about what's going on at this particular situation, and I will not talk about what the other dentist has done, or I'll not start comparing my work with them. That is very unethical. So you will only talk about what you see and what treatment plan you will devise for the patient. And if the patient goes on to ask if the other dentist has done something wrong, there's nothing for you to comment on that. You can only tell that I can only see what's going on right now. There might be different scenarios under which the other dentist would have done this. It is not for me to comment. And that's how you would handle that. And your answer was good for that. So the next scenario is about a 48-year-old patient with a rude attitude. For that, you said that you would counsel the patient, and if the patient doesn't listen to your instructions, you would still do the fixed partial denture, but you would explain to them that so and so can happen, and you would get informed consent from the patient. So that's one way of handling it. Another way, and another thing that you have to understand with this case is that if the patient is not willing to comply during the treatment phase, there's very little chances that he's going to comply after the situation, right? So one way of handling it is your way. Another way that I would handle this is I as a dentist, I always feel that the patient and the dentist, they both have certain responsibilities. I feel that we both have to give each other the same respect. So the patient is not willing to take care of his part, then I don't want to do my part. So I have the right to not provide treatment if I feel that this patient is not going to go ahead and comply with it. So I'm not going to leave the patient abandoned. I will tell the patient that so and so can happen, and if the patient is not willing to respect that, then I'll refer the patient to somebody else. And I'll make sure that the patient is taken care of, but I'm not going to go ahead with the treatment because I think that that's going to, if there is no trust and if there is, that mutual relationship with the patient and the dentist, then it's not something that I'm going to go forward with. That's my philosophy. But there are different kinds of philosophy, right? Like the one that you said, like telling them that, if I go ahead with the bridges, then it's going to fail in some time, but have them sign an informed consent and then proceed to the fixed partial denture. Another thing is explaining to them that your disease is, extremely high. We'd have to get it under control. And only after that, I'll proceed with the treatment and not providing any treatment before that. Another is having them go away from your office by referring them to somebody else, which is my philosophy. And you can stop me anywhere if you want me to clarify something. So the next is the periodontist situation, where you have a referral patient and the patient has this mild bleeding and over-contoured crowns. I think what you did was great, where you did the examination and you know that it's unethical to explain about the other things. The only thing that I wanted to add over there is it is okay to tell the patient about the crowns because it's your finding. That's the cause of that. It's you don't have to tell them that the other dentist might have done something wrong, something like that. But it's important to maintain veracity over here. So it's okay to manage it in your your perspective as well. But in my perspective, if I was the periodontist, I will tell that so and so is happening, and I believe that it's because the crowns might be a little more bulky, and that's why I feel this is going on. So even though there's a trust thing going on with the previous dentist, it's also important to be truthful to the patient and then talk about what the treatment plan can be. And I also like that you want to discuss with the general dentist about what happened, because one thing that a lot of people fail to understand is there might be a reason why the previous dentist has done so and so treatments, or there might be a situation that was going on that we don't know. So we can't comment saying that the dentist has done something wrong, right? So that was good.
But in this case, I just want to ask you this, that if you tell the patient regarding the crowns, then patient would go and tell the general dentist that periodontist told me that there is some problem with the crowns.
Yeah.
So then won't it complicate things between
No, it will not complicate things. I just feel that it's important to explain what's going on. So if you tell them that in this area there's mild bleeding and there's inflammation, the patient themselves will understand that there are crowns over there. So if you don't comment on it, then it also affects the trust that the patient has on you and in the dental community, right? We should be willing to take constructive criticism over whatever is happening. So as a periodontist, I will tell them that, okay, Mrs. Jones, I see that there's mild bleeding and there's inflammation around this area. After examination, I feel that the crowns could be a little less bulky. There are ways in which you would form the sentence, right? There might be a little bit of lodgement of food. I'm sure that that your dentist will be able to take care of that. That might be something that we'd have to change. That's it. So the way the patient takes it can be different, So, and discussing after that, I'll discuss with a general dentist, asking like, I feel that this might be the reason. Do you have any idea why you might have done that? Whether like deep caries or something that you wanted to take care of, or were you testing it as some provisional crowns? What was going on there? Right? It's okay to do that. Yeah. It's only not okay to tell them that, yeah, these crowns are really badly done. They're very bulky. That's the reason. So I understand what you're asking. It's always a little bit of a trade-off that you have to do when it comes to this kind of situation. And the next one is you're working with one instructor and the other instructor comes with a different treatment plan. I like that you spoke about the director, which tells me that you listen to the webinar.
Yeah, I heard that. Yeah.
Yeah. I was thinking whether I should ask you that question actually, because I knew you'd answer it.
I thought if I should mention it in the before starting.
Yeah, but I like how you improvised by telling about the Professor A and B huddle. Practically it's not possible because we don't have enough time to go through with that whole treatment plan sequence. Disagreement, going with the team leader or the director and discussing with them and then deciding which treatment plan you are going to do and then coming to the patient, that's perfect. Never go to the patient first and discuss it because it kind of destroys the trust that the patient might have on you. So no comments on that answer. I like how you approached it. The next question is, an instructor asks you to do a sequence of steps in a restoration appointment that does not make sense to you logically. So what will you do? You present to him the facts that you've done and you've learned, and then you have an open discussion. I like that. I just wish that if it was me, I would just first follow his instructions, complete the treatment, and then come to him and discuss it. It's just a different sequence, but that's how you handle it. And I also like the point where you told that you're working under his license. That's absolutely true. You are working under his license. So, it's important to acknowledge that. But yes, you're here to learn. You're here to understand the philosophy that they are doing. So it's no point telling them that I don't think this is right. Even if you know that you just can't do direct pulp capping in pediatric teeth, but you're just going to do it and then understand the philosophy later on. So that's good. That's actually not more like an ethical question. That's like a question that interviewers ask just to throw you off. So, okay, let's go to the next scenario where we talk about that pain of unknown origin, right? So there, one thing that the whole scenario revolves around trust, where this patient she trusts you so much that even when the other dentist diagnosed something else, she didn't want to tell you that you did something wrong, that she didn't want to tell you something else. She just wanted you to take care of it, even if it was an extraction, right? So I think one thing that you maybe could have mentioned is cross-examining with your previous records to see if you might have missed it. Like you were saying that I know I examined it thoroughly. Sometimes we might miss certain things. Sometimes we could have missed, that thing in the radiograph. So it's okay to actually go back and see and examine. And yeah, it might have happened over the weekend, which you said, like it might have happened during that situation. And you spoke about misdiagnosis. I was waiting for you to talk about it, so I put a tick over there when you spoke about it. So it might have been a misdiagnosis on the dentist part as well, where you say that I still stick to my diagnosis. I think that this is what is going on. There might be some artifacts in the radiograph by which the other dentist might have told that. But I feel that based on what I've seen, I don't see any source for your pain. So I would refer you to an orofacial pain specialist to see if it could be something of a neurological origin. So that was a good answer. Other ways that people handle this is extracting the teeth after they look at the radiograph, or proceeding with root canals, or referring to a neurologist, doing some temporary crowns to see if that improves their situation. So those are other ways in which people handle the situation. But the way you did it is good. It's just that, addressing that trust in that situation could have been, just figuring out what's behind that theme. Yeah, that's one thing. Next is Miss Walker. Is a new patient, so her sensitivity to cold when she brushes her teeth, and then the irreversible pulpitis situation that sprung up. Right. So first is addressing that we did something wrong, but we did not explain to them. And here we could have brought in the concept of informed consent, where we would have taken an informed consent before we did that restoration. But there are certain things that we don't address, right? Like informed consent is pages and pages long. We only talk about the most common, outcomes of the treatment with the patient. We don't talk about the outcomes that are very rare, right? So this might have been a rare outcome, right? So explaining to them that it is rare, and that is why it was not explained, but it was there in the informed consent. That's true. But it's also a mistake on our part because we didn't explain to them, that would have happened. So explaining to them that, and I would, if it was me, I would take up the expense of the treatment, only because it caused distress to the patient, and it was it led to distrust. One thing that at least what I learned from my faculty is that you don't apologize to the patient immediately, because it kind of immediately destroys trust, because it seems to them it's like a validation that you've done something wrong, right?
Understood.
Right. It's not wrong to apologize, but first explain to them under what circumstances this has happened. Tell them that it was there in the informed consent. It was there everywhere. It's just that the reason why it was not told to you is because it's a very rare complication. It's like the back of a tablet or something like that. Right? So, yeah. So, informed consent, you explain to them what led to this condition, and then what are the next steps and the importance of doing an RCT. And then you said that I would leave the expense part to her. Sometimes I would give her a discount because it is, the reason for that.
Partly on my side.
Right. So another thing that is ethically important over here is to document the situation. Document it in her, case report that so and so happened, and then, just to avoid that medical legal case that could, spring from the situation. Right. So let's move on to the last thing. We're about the whitest shade. Yeah, this is a very common situation. The way you handled it is to explain, to bring the shade guide, to show it with their complexion, and to tell them that, this is the better shade for you, and also show your previous cases to them. That's a great way to handle it. I just wanted to throw in my suggestions in this. There's no right or wrong way to handle this. Your way of handling it is great. Some of the other things that you can do is, if the patient does not get convinced, is to get the patient to wax trying and do 2 sets of dentures. One with the teeth that he wants, and the other with the shade that you think is best for the patient. So you have them try in and then show them which is better, instead of doing the complete denture and having the patient may not be happy. But yeah, we did get informed consent saying that it's not our responsibility if the patient is not happy with that shade at the end of the treatment. Another thing that you could point out is, usually when you do the shades, they say that it has to match with the whites of your eye. That's one thing. Or have the assistant chime in and tell that, yeah, I think that's a great shade. Or another thing is to take only 3 shades to the patient, not the entire shade guide. When you take the entire shade guide, you're going to be in the office for the entire day because they're just not going to be, decisive. So yes, when it comes to ethical in this situation, if the patient does not agree, informed consent is so important at the situation which you addressed. You have to document each and every situation in this patient, especially a patient who is, aesthetically like very critical. It's important to document that, because it's so easy for this patient to turn tables on you and tell that I did not say that, right? So it's good that you address the informed consent. The other things that I added was just ways of handling this situation. So that brings us to the end of the scenarios that we discussed. So to summarize, I want you guys to be succinct. I want you guys to think out loud what you're saying. Third is, stick to your philosophy. If you think about various situations and ways in which you can handle this, first talk about your philosophy, and then tell about what are the other ways in which this could be handled if something goes wrong. So that's how I would handle any ethical scenario question.
Thank you, guys. You guys have spoken nonstop for, I think, a little over an hour. So hats off to that stamina, I guess. And okay, do you have any words in closing you want to ask, Viral?
No, I think it was a great experience for me also to attempt this, and it was pleasure to face such so many scenarios and try to think different ways, and and I think the end part which I was lacking, I learned also from Dr. Nourah that okay, I should end it effectively, and what I am going to do it, I should mention that. So I think it was a very informative session for me too, and I was very happy to be here.
Sure.